So we have Jasmine Reinders joining us. She's a clinical nurse in interventional radiology, and I will turn it over to her to more formally introduce herself, and then she'll dive in talking about kind of what her day-to-day looks like, some of her favorite parts of her job, least favorite parts, and all of that good stuff. So go ahead, Jasmine. I will turn it over to you.
Yeah, thank you so much. Yep, so I'm Jasmine Reinders. I am a registered nurse in interventional radiology. Like you, I actually started in ProHealth Care when I was a lot younger. I've actually worked here since I was 19, and I was a unit clerk all the way through nursing school. So I've been an RN for just under 20 years now. But I'm what I call myself a ProHealth lifer. So I'm that's where I'm at. You just go to the next slide. So interventional radiology is a pretty neat specialized area. So what we do is we do surgeries, but to do them, we do it all with image guidance. So we don't have to do large incisions into the body to do our treatments. We do all of our procedures through pokes. And by doing that, we can help out a whole bunch of different areas. We can treat a lot of different kinds of conditions by doing that. So like I said, I started here when I was 19. During those years, I was attending Waukesha County Technical College. I really liked WCTC. It was hands-on, and it really gives you the ability to, they have you obviously become a CNA first, which you're already doing, but it gives you the ability to be hands-on all the way through your schooling, which was really nice. I graduated in December of 2004, and I'm currently working in interventional radiology. I've done this for 10 years, and I've had a couple of other jobs along the way. I did start in the emergency department with ProHealth to get some background prior to coming to interventional radiology. So for me, when I was in school, I loved math. I loved science. Biology was my favorite. I liked it a lot more than I liked physics and that kind of thing, but just always really enjoyed math and science along the way. I like being hands-on. I like with nursing that you're not sitting at a desk all day, you're up and moving and doing things, and just really liked the physical aspect. The other thing I like is you can talk with people face to face. It's not, all of the electronic or, working from home in an office, where you may not be around other people quite as much. I really like that social connection with patients and with coworkers alike. And then I like to help other people. It's always really nice to be able to make somebody's day a little bit better in one way or another. So that was another thing that drew me to nursing. Interventional radiology itself. So in 2006, I was working in the ER at that point. My grandfather was diagnosed with liver cancer, and he started having some specialized treatments done through interventional radiology. So that's where I first learned about the department and the things that were done there. I was exposed to, him having his liver treatments all done through pokes with just cutting edge, treatments that he was receiving in the department. So who do we treat? We are an interesting area in that we help out pretty much every specialty that there is within the hospital. So we help surgeons if patients have diseases of their veins or arteries, we can go in and do treatments to open up blockages there. Patients that have cancer, we do biopsies. We can treat tumors by giving medications directly into the tumor itself, which prevents the patients from having some of the typical side effects that you would get with chemotherapy. We also do port placements into the chest to administer chemotherapy, so we do that as well. Urology patients, sometimes they will have obstructions or blockages in their systems that they can't fix through a conventional surgical methods. So what we can do is place special drains or tubes to help that area. Gastroenterology, or like the GI system, there are different blockages that can occur there. Bile ducts, patients will have bleeding in that system. We can take care of those. Infectious disease, we place specialty IV lines called PICC lines for treatments. We can drain fluid collections if patients have infection. Kidneys, we treat renal artery narrowing. Problem with that is patients get really high blood pressure if those arteries are narrowed, and we can help correct that. And then for patients whose kidneys aren't functioning well, we can also place and maintain dialysis lines for those patients. One of the big things that we do here, neurology-wise, if patients have a stroke and have clot within certain smaller areas of the brain, we can actually go in and do what's called thrombectomy. We go in through, basically, think about it, a really long, flexible straw. And when we get to the tip of that straw, we have a couple of devices that we can remove clot with. We also just do some general procedures. Patients will on occasion have fluid buildup from one problem or another. They'll have fluid buildup in the abdomen or in their chest cavity around the lungs. And we can go ahead and drain that fluid. That can make patients more comfortable. If the fluid's in their chest, it can help with any breathing issues that they're having. And then we also do IVs just for patients whose veins are not particularly easy to access. We use ultrasound to do that and have some special equipment to do that as well. And then one of the last areas that we help with are patients with musculoskeletal issues. So we'll have people that have fractures in their back, compression fractures, and we actually will go in and inject cement directly into the bone. And what that does is it keeps the fracture from moving around. And when the fracture isn't moving, the patients typically no longer have pain. So we're able to fix their pain by using cement. And then the last thing that we can do is nerve blocks. We can actually go in along the nerves, and we can basically give medications in there, or we have a couple other methods as well that we can treat any nerve pain that patients are having. So on a day-to-day basis, I work with our interventional radiologist. We typically have one radiologist doing interventions at each of our sites. And then we have one or two nurse practitioners that also do some of our procedures. They do some of the consulting, which is going to see patients bedside, coming up with treatment plans, and the nurse practitioners also do procedures as well. And then we have our interventional radiology technologists. They are the ones that put on sterile surgical scrubs, they put on a gown with our doctors, and they actually help the physicians with all of our devices and equipment that we use. A lot of the items are very long or can't really be handled by one person, and the interventional radiology technologists are the go-to and assist the physicians with all of that. Anesthesiologists, we do conscious sedation on a fair amount of our patients, and that's just giving a little bit of a sedative through the IV. But for procedures that are more painful or may take a longer period of time, anesthesiologists will come in and put patients asleep for some of our procedures as well. And then other interventional radiologists, registered nurses. We have typically 4 when we're at our Waukesha location, and collaborate with them throughout the day just to make sure we're getting all of our patients' needs taken care of. The last group that we work with is nurse navigators and case managers. We work with them to come up with plans for our inpatients and our outpatients, just to make sure that they're getting the best treatment that they need and that they're able to get patients lined up with us in a timely manner to get treatment started. So, sure, from a list of things that I covered, you realize that we treat a lot of different types of patients because we treat such a broad variety of conditions. It's really, really important that you have some sort of critical care background coming into interventional radiology. And for us, the pathway that brings us most of our nurses is either intensive care or emergency department nursing background. 80% of our nurses will have worked in one of those two areas prior to coming to us. So when do I work? It's a beautiful thing with nursing is you have flexibility to work full-time or part-time or whatever you find works for yourself and your family. I work eight-hour shifts every 2 weeks. So that is 32 hours a week. They're daytime shifts. I start anywhere between 7:30 and 8:30 in the morning, just depending on the day. And then I'm also on call, and that is one evening every other week. And then every 10th weekend, I take call as well. And that would be for procedures or needs for inpatients that have something that can't wait until the next business day. We'll come in and do procedures in off hours as well. So daily responsibilities. First thing we do is we come in, we look at the patient's chart, figure out just kind of what their needs are going to be. We look for things like patients that may have difficulty lying flat or may have pain, kind of screen for all of those types of things. And then we prepare for our procedures for the day. So to do that, we set up the procedure room. We'll set up a sterile tray with all of the equipment needed for the procedure. And we also set up patient monitoring equipment. So that would be blood pressure, oxygen, all of those needs. And then during the procedure, I administer the conscious sedation for the patient. I am up at the patient's head. I can talk with them when they have light sedation on board and just see how they're doing, see how they're feeling, be the one to kind of explain to them where they're at in the procedure, and just make sure that they are safe and comfortable during that procedure. Then we also provide patients with education and just emotional support. When we see somebody, they typically have something going on. So patients have a lot of questions just about what we're seeing, how things are looking during the procedure, and we're able to provide that information and update people along the way. And then just collaborating with patient care team members to just ensure that they're getting good care. So if a case is going to be delayed a little bit, we'll call the nurse that's working with them at that time to let them know, keep everybody up to date, and just make sure that everybody's on the same page for the day. So the way that we do our procedures, we use live x-ray, which is called fluoroscopy. And basically with that, the physician can step on a pedal and it takes x-ray as long as they're stepping on that pedal, which means we can take live time x-ray and see in the body, we can see movements, we can see patients, breathing, their lungs moving, we can see all of that on our x-ray. For other procedures, we'll use the CAT scan machine or ultrasound to see into the body and see what areas we need to treat. Once we can kind of see what we need to do, we use a needle and puncture into whatever it is we're working on. So it may be a blood vessel, it may be a fluid collection, but we use a needle to get into those areas. And then we just have our room looks like a garage. We have cabinets full of all different stents, coils, tubes, and they're literally in cabinets that look like your typical automotive shop, just a lot cleaner. And what we do is we have different balloons. We can inflate to open up blockages. We have stents, those can go in and hold vessels open. And we have different coils, tubes, and just drains that we can use to treat all of our different conditions. So just a lot of different equipment. And then through some of those, we can deliver medications directly to a body part to treat. So that would be like the cement that I talked about in a patient's spine. Or if a patient has cancer, we can actually deliver chemotherapy right into a tumor to prevent those other side effects that we were talking about. So what I'm using during the day when I'm working, one would be a hemodynamics monitor. So that's basically just your monitor that has your blood pressure, your patient's heart rate, all of that on there. We also do a special monitoring called end-tidal capnography that measures how your patient is exhaling so that we can make sure that they're not over-sedated during procedures. We also have little handheld ultrasounds. With those, we can check for patients' pulses before and after procedures, make sure that we are having good blood flow in the areas that we're treating. We also do point of care testing, which is minor lab testing that we do right in the procedure room as needed. And then positioning equipment. We have lots of different foam and gel items that are in various shapes to help get patients into the position we need. All of our medications are in an Omnicell medication system. It's a big, secure medication dispenser that we access and accurately pull doses of medications. And then just general equipment, syringes, blood pressure cuffs, oxygen cannulas, telemetry patches are the little stickers that go on the patient's chest. Those are a lot of the items that I use on a day-to-day basis. The good and the bad. Favorite parts about my job, every day is different. Because we treat so many different parts of the body, no 2 days are ever alike. We do lots of different cases, and it's nice to have a kind of a new day every day. Different technology, there's always new medical equipment and devices being made. Interventional radiology is an area that's rapidly advancing, and we see new equipment all the time that provides a lot better therapy and treatment for patients. And then I love being able to calm a patient's nerves and see a patient feel better after procedures. Patients with us, because they're having a procedure, tend to be quite nervous. It's very nice at the end when you tell them in the beginning that everything's going to be okay. It's not going to be that bad. And when patients tell you this was super easy, and are thankful and they're feeling good, it's very rewarding. Bad parts, we do see a lot of patients that are towards the end of life. That can be difficult. You form bonds with patients, and seeing them at end of life can be a challenge. And then we have few healthy patients. And what I mean by that is if you work in like a primary care doctor's office, you have patients that come in for routine preventative care. We don't see a lot of those types of patients by us. And then smells. Because we're working on things that need to be drained and in all different body parts, there are definitely some smells that come along that you adapt to over time, but as a new or young nurse can be a little bit challenging at times. Nursing skills for our area, multitasking is probably the main thing. I am typically typing into a computer, giving medications, looking at my patient, watching what the provider's doing, looking for instructions, and then just cues that anything is changing with my patient. And you're doing all of those things at once. And then adaptability is, whatever is planned for your patient for the day, you may get into a procedure and they find that something has changed and we need to switch up what we're doing or switch positioning or, maybe do a completely different procedure than what we initially planned on. And that's really important to just be able to kind of roll with those changes when they occur and be able to, step into whatever needs to be done next. And then assessment is huge. Just using your eyes, your ears, your hands to evaluate for changes in patient condition. A lot of times, you might just look at a patient and see maybe they look a little bit more pale to you than they did initially, and you lay your hand on them and you realize that they're a little bit sweaty. And in nursing world, that usually means they're not feeling the greatest. So it kind of cues you into, okay, now I need to recheck their blood pressure and I should be asking them how they're doing. So just those assessment skills are really important. Working for ProHealth Care is wonderful. It's a comprehensive healthcare organization, but it really has a family feel. I feel like everyone that I work with in my department is my second family. You spend a lot of time with individuals, and even walking through the hallways, individuals are friendly. You get a whole lot of just great rapport with other areas, and I really enjoy that. And then they're very present in the community as well. A lot of preventative health programs, classes. There's events like the ProHealth Care Walks for Cancer coming up. There's, sponsorship of the, doc hounds and all of that. And they're just very present in the community, which is just really, really nice to see. I'm proud to work here. And this is a quote that I love. Says, "Challenges are what makes life interesting. Overcoming them is what makes life meaningful." So every day as a nurse, you will find things that are different and challenging. And it really is meaningful when you can overcome them and make not only your life more meaningful by knowing that you took great care of individuals, but also fulfilling for the individuals who you were able to help overcome what they have going on.